Hello, I'm
Steve
Dr.
Easy
Kim
Hands-on의
Kyung-won of Dr. Steve Easy Hands-on. Today, I'm going to talk about LAST kit. LAST kit is lateral approach sinus kit for safe elevation of sinus membrane. And after that, you can do bone grafting and place implant. So it's a sinus surgery kit for lateral approach. So what are the characteristics of this kit? First, lateral window can be formed more easily and safely with this kit. You see core drill in this diagram, and it has inverted cone shape and rounded edge design, same as the cast drill. And we also have dome drill, so you can also grind window. In other words, sinus membrane can be protected and the lateral window can be formed more easily. It also has various sinus instruments so that you can safely and elevate the sinus membrane more widely. Thirdly, you can use this type of bone graft carrier. So sinus lateral approach, after that is done in doing bone grafting, saliva being contaminated or leading to second infection can be prevented for more easy bone grafting. So let's see what the component of this kit is. In the upper deck, we have tools for lateral window formation. So dome drill and core drill, and it also has stopper. In the lower deck, it has tools for sinus membrane elevation. So for sinus surgery, instruments are included, and we also have tools for bone grafting. So first, let's talk about dome drill. In the last kit, there are two types of drill. First, dome drill is where you can more easily and quickly form window, and perforation of the membrane or membrane damage can be prevented. So it grinds the lateral window. So this is how it looks. Diameter, you have 5.5 and 7.0, two types. And dome drill, the cutting itself has smooth cutting force and it has minimal expulsion. This means that while grinding, you can collect bone chips. The blade allows for that, and it forms again bone chips, and because it's in dome shape in lateral approach, if the surgical field is too narrow, then you can tilt it and drill. Next is wide dome drill. When you do formation with dome drill, when you grind, the window could actually on the center part be narrow. And if you have narrow window, you can then use wide dome drill so that you can widen the lateral window. And if necessary, you can use this tool for further expansion. So the recommended RPM is about 12 to 1500. So width is 7 millimeters. And then you have side wall drill. And side wall drill is after wide dome drill. If you have sharp bony edges, then this is a drill to remove sharp edge of bony windows. So you can cut side wall, so it has the drill for that and the tip to safely protect the sinus membrane. It has dome shape of drill tip. And here, in the lateral drill, for the length, you mount stopper, and we use cast drill stopper with the sidewall drill. So sidewall drill uses the cast kit, and the dimension is like 12 millimeters cast kit stopper. If you mount then sidewall drilling depth will be 5 millimeters. So 5 millimeters of the drill will be protruding. And if you have a stopper of 8 millimeters, then the blade length of the drill will be 1.0. So you can use it more safely. Next is core drill. And dome drill, lateral window, you grind it for formation, but core drill, forms the bone lid while drilling. So bone, as you form bone lid with the conventional drill, and you can also form bone chips between blades. And basically, the drill concept uses the same design of cutting blade of cast drill. So more safely, without damaging sinus membrane, you can form window with this core drill. Next, we also have in the last kit the dome drill and core drill. With it, we have the stopper to mount on those drills. The basic concept of stopper is from 0.5. We also have 3.0 millimeters. So these numbers indicate that if you mount 0.5 millimeters, the blade will expose by 0.5. And if you use 3 millimeters of a stopper, then the drill blade will be exposed by 3 millimeters. So if you form lateral window, in the sinus wall thickness is about 1 millimeters. So if you have about 3 millimeters, then safely you can form lateral windows without any problems. Now there is a bone separator. This is a tool to remove a bone lid stuck inside the core drill. So if you have lid left in the center, it's very hard to remove that, but for that you can use this instrument. Sinus curette. This is tool for elevating sinus membrane, and we have short form and long form. If you use the short one, then in the shallow area close to window, you can use this for elevating the membrane. If it's a long format, it's longer, so it has 3 curvatures. So within sinus cavity, whichever location, direction, it's very easily accessible with this long curette. So in the inside, on the optomesial wall, you can fully, widely elevate the membrane. Next is membrane separator. So the separator on one side has around the dome shape. So piezoelectric kits is something that you will think about because very similar. So when you open the window, so in other words, when you do initial detachment, if you use this side of the tip, you can very easily separate the remove bony window and detach sinus membrane initial stage. And then you have this other side. So this other side is used to fill bone graft inside the sinus cavity via a crystal drill hole. So as a plug, you can fill the material. Next is FREER elevator. It's an instrument that I use most frequently, and a lot of procedure can be performed with this. So on one side, that you can be used to separate the lateral window or to elevate the sinus membrane, and it can also be used for bone grafting. On the other side, the bended part is for sinus membrane elevation, and basically FREER elevator tip, the width is 5 millimeters, so it's a bit on the wide side. So using this very safely, you can elevate sinus membrane. Next is bone graft carrier. On one side, you have this type of spatula shape. So graft material, without contaminating the mouth, you can bring it to the lateral window and do bone grafting. So it can be used to carry bone graft materials. And on the other side, the FREER elevators width, I said, was 5 millimeters, but this is a bit narrow tip. It's 3 millimeters in width. So if the lateral window side that you formed is a bit narrow, then you can use this narrow tip for membrane elevation. So last technique, basic procedure is the following. Basically, there are 2 techniques. can use dome drill, or you could also use core drill. So if you use a dome drill, the sinus lateral wall, you grind it in the window formation. So that's how you form window, through grinding of the sinus lateral wall. And core drill technique, you form lateral bony window with round bone lid. So that would be the core drill technique. Now let's explain about the practice of easy hands-on. The easy hands-on practice will be we'll be using last kit and lateral approach, and go to sinus cavity, do sinus bone graft, and then place implant. Using mock-up, I'll show you that procedure. So the mock-up that we prepared in terms of residual bone height in number 16 and number 17, if two are missing, then 4 millimeters number 16 and 3 millimeters for number 17. So for these two teeth, using the dome and core drills, we will form the window, and then using sinus kits, you will use the instrument to elevate the sinus membrane, and then do bone grafting and place implant. So basically, number 16, we will use TS 4.5 10 millimeter implant, and number 17, we will use 5.0 8.5 millimeter length implant. So using dome drill, we first create bony window, and there wide drill, we expand further, do sinus membrane elevation, bone grafting, and place implant. With the core drill technique, we form first bony window, but with this drill, sometimes you have a bit narrow window. Then we do overlapping, create a window next to it, so that lateral window can be wider. Then after that, we elevate the sinus membrane, graft the bones, and then place implant. And through hands-on, I'll show you how to do it. So I'll see you in the hands-on part.
이제 핸즈온에서 만나 뵙도록 하겠습니다.
So now I'll start the hands-on of last kit. Numbers again, 16 and 17 is missing cases, and last kit dome drill technique will be performed first, and then I'll move to the core drill. So number 16, about bone height remaining is 4 millimeters. Number 17 is 3 millimeters or so. So for your understanding, the sinus floor, I will mark it first. So like this, you see sinus floor. And dome drill diameter, you have 5.0 and 7.0. So first I use the 5.1 and then use the 7.1. So first 5.5 will be chosen. So 5.5 dome drill, there are two dome drills, 5.5 and 7.0. So I'll use 5.5 first with the stopper. Like this, that is 0.5 millimeters. So 0.0 millimeter means the blade is not very visible because it's too short. But anyway, lateral window on the sinus floor and on the front part, about 2 to 3 millimeters gap. I will first form the window with this instrument like this. And it's only 5 millimeters, so it's only 0.5 millimeters in other words. So next I will use 1 millimeter stopper. That means that you will see a bit of the drill blade. So like this. So you see the diameter is a bit on the narrow side. So dome drill will switch from 5.5 to bigger one, 7.0 diameter dome drill. Then again, stopper. We will first use 1 millimeter stopper first. So mount that stopper. So drill, you see a bit protruding. Again, with the dome drill, lateral window is grinded. So as you can see, there is a bit of perforation, but it's still very thin. So I will use 1.5 stopper. Lateral wall thickness is about 1 millimeter, but there is a banded area. So I'll go now with 1.5 stopper. So 7 millimeter diameter dome drill with 1.5 stopper. And as you can see, 1.5 stopper, you see like this, the sinus on the lateral wall side, you see a bit of perforation. So that's it. I think 1.5 is sufficient. Then the hole is a bit on the narrow side, so we now opt for wide dome drill, 7.0 diameter, but it's a bit wide on the front. Stopper 1.5 mounted. Like this, with the wide dome drill, you see there is a bit of expansion, widening. So sinus, you see, has been widened, and there is sinus mucosa, and sinus has been, penetrated. The sinus mucosa, but there is a bit thin area remaining. So I will use sidewall drill to remove it. Sidewall drill is this one. So this one stopper, we use CAS stopper. So with sidewall drill, and we use 9 millimeter CAS stopper. So we mount that on the sidewall drill. Then sidewall drilling part is about 2 millimeter truded. So the sharp area, we push it like this, the dome-shaped part can protect sinus membrane. So we round it so that the sharp part can be removed. So the thin remaining part with the sidewall drill has been all removed. So with the wide dome drill, we do the widening and then of the sinus instrument. First, for the initial detachment, like rounded part can be used. Then the sinus and lateral window and between membrane and bone, initial detachment can be done. So without hurting the membrane, very easily you can detach membrane. Now, personally, the Freer elevator part, I use it. So the width is 5 millimeter here. So depending your preference, I think the part you go first is different, but I think this top part might be the easiest, and if necessary, the mesial area is then detached because that is kind of very thin one. So in the clinical setting, elevating sinus membrane, if you elevate, it's easy to tear. So sinus membrane, you let it touch the bone and push it, then sinus membrane can be easily detached and membrane will be elevated. So like this, even on the inside, on the deep side, so even on the sinus major side, even to the nose lateral wall side, even on the inside, you need to fully detach so that there could be wider elevation. And then sinus curette, the short part. Using the short one, like this, sinus membrane can be elevated. And if going a bit deep, like this, it has three curvatures. So on the front part, like this, on the distal side, the opposite side, if you access like this, then with the sinus curette, you can go and access any direction. And on the using the long part, then like this, even deep side, inside, even on the mesial wall side, you can go in. So even on the inside, the mesial cavity lateral side, you can go in. So on the distal, using the opposite side, you can fully access and go in. So if you use sinus instrument properly, then sinus membrane can be very safely and fully elevated. Now it's all been elevated. Now I will do drilling. And 1 to 2 taper kit will be used. First, drilling site will be marked. Then, first, guided drill will be used. So if you're worried about hurting or tearing sinus membrane, then in clinical setting you don't have to like fully open it like this, but like this you protect and then you mark the drill hole area. And then parallel pin will be put on. Then number 17, like this, we mark the drilling site. Then again, parallel pin used to check the drilling position, and you check the occlusion, and as you can see, the punctional cusp on the lower side drilling path can be confirmed. And number 16, TS3 4.5 10 millimeter and number 75.0 8.5 millimeter fixture will be placed. So bone remaining is 4 and 3 millimeters. So drill will just use 8.5. So first, with the straight drill, I will expand the hole first. And as you can see, this is 2.2 diameter drill. And from here, again, you drill sufficiently. Remain bone length is 4 and 3 millimeters. So you don't have to opt for 3.5, the long one. So I will just go with 8.5. So diameter 8.5. And fixture 3.5 will be used. And like this. And also, here also, fixture 3.5. And number 16 will go up to 4.5. So with 8.5 drill, I'll do the final drilling. So number 16 drilled with the final drill. Fixture 4.5, and number 17 is 5.0, 8.5 millimeters final drilling. So now I'll go for bone grafting. As you can see, with the FREA elevator, I put the graft material in here. And if needed, then like this, in bone carrier, the graft material is put in, so that more smoothly the bone grafting can be done on the sinus. Like this, with the free elevator, will do drilling clinically because the patient is lying down. Bone grafting goes toward the back side, and on the opposite side of the free elevator can be used and move like this to prevent the material from going too much toward the back. And as I said before, just in case, using this plugger tip, the drilled location along the drill hole like this, you can also do the bone grafting. So depending on position, if you're just wondering whether material has gone in or not, then along the drill hole from the crestal side, the graft material, you can check that it goes in properly. That's important. And if you think window is too small or narrow, then again, freer elevator diameter, the width is 5 millimeters, and this one has bone carrier is narrower, 3 millimeter. So even the narrow site, bone grafting can be performed very well. And if the material is dry, then while doing grafting, if it goes in touch with saliva, then biofilm can be formed and contaminated, resulting in infection. So like this hydrated bone graft material, don't push it too much toward the back, and be cautious about that in doing the grafting. So make sure it doesn't go toward too much back. I think grafting is almost complete. Now, using the mount driver, TS3 10mm implant of 5.5 diameter will be installed like this. It's placed, and before putting it, delivering orally, check that it's in the right mode, and then place the implant. So in the drilled site, like this, you place implant. I think it's almost done. Next, TS3 diameter 5.0, length 8.5, implant fixture, like with the pre-mount. You check, and you check again that it's in the right mode, and then place the implant. And if it's placed, then using the hand wrench, implant will be placed in the final depth. In case TS3 residual bone height, if you go minus 1 millimeter, but if the residual bone height is not sufficient, you go bone level because you cannot go too deep. But if you go slightly deeper than bone level, it will be good. And you check that there is a sufficient primary stability. And so like this, the implant fixture has been installed, and graft material is protruding. So again, put that in place, and after that you check occlusion. Then as planned, you see it's been done correctly in the correct site. Then pre-mount, the mount will be removed with the open wrench, because if stability is weak, it can get loose. So like this, you loosen it, and same for this also. And you put in cover screw, then implant placement is complete. We use dome drill, so we grinded window, and the window, there's no need for repositioning. So you can just suture, cover up like this, or you could just cover it with collagen membrane first. And that's it. So this is how it's complete. So compare the sinus. You see on this side, membrane has been fully elevated, and bone grafting and implant placement, you can confirm has been done. So the second part of the last kit practice is forming window with core drill and then do sinus grafting. So core drill diameter, you have 5.5 and 7.0, but 5.5 is a bit too small, so we will use a 7.0 drill. And then last kit stopper, we'll start with 0.5. So 0.5 stopper will be like this, mounted. And sinus floor is already formed, so on the 3 millimeters from the front and back side of the floor, we'll go in to form window. So indentation with 0.5, and 0.5 is a bit too small. So we will now go with 1.0 stopper. And as you can see, core drill, we mounted the stopper, then 1 millimeter of a drill is protruding. So again, go in. Like this, if you drill, then as you can see, if you remove stopper in core drill, you see the bone chips have been collected. So window is not fully formed, so I'll go one up again, 1.5. 1.5 stopper mounted to the core drill. Like this, we form the window. And as you can see, still the window is not fully detached. So 2 millimeter stopper will be used. Like this, 2 millimeter stopper will be used. And here, the lateral wall is bended, and that's why it's not fully detached. And like this, try to form window by going in. So we detach the window. And as you can see, just in case if the hole you think is too small, then in some times you can, create one more hole right next to it. And then, as you can see, a bit wider window will be available. Once the window is formed, then first, using separator, you see, you detach, do initial detachment from the sinus membrane and using FREER elevator like this, distal side and also medial side, also on the front side, sinus floor side, and even the inner side, you detach fully. Or using sinus curette, like the front part, you can elevate, or the opposite side, the back side, you can elevate. So you first use short shaft for this part, and then for the longer one, you can even go deeper. Then sinus membrane will be fully elevated. So on the distal side, you do fully detach. Then sinus membrane is fully detached. Even on the inner side, you see there is a full elevation. So you drill up to the area you marked with a laser. So always when you perform sinus graft, make sure it doesn't go too much toward the back. Then you put in the fixture. Then you put it in place with the wrench like this. And because we use core drill, there is a bone lid that's been detached. So we bring the bone lid back into the position. So like this. Then surgery is complete. And as you can see here, bone graft material is all in there, and bone grafting is done, and implant is placed, and sinus is fully elevated. So if you're worried about hurting sinus membrane, and if you're using last kit, then with dome drill, you can grind the lateral window. And if you use core drill technique, as you've seen in the practice, you can form bony window and then detach the window. So lateral approach can be performed more safely. Now let's answer some questions. We have two questions. First one, it's about of the dome drill and core drill, which one do you recommend more? Now, in my opinion, I personally like core drill more, because when you use core drill, then the core drill itself is the same in terms of design as cast drill. So reducing damage of the sinus membrane, it can form the lateral window and detach the window and then position it back afterwards. So that's why I opt more for core drill. But when you use core drill, sometimes the window size can be too small. Then in that case, as I showed you in the practice, you can, make another window right next to it to widen the window. When you use dome drill, then lateral wall is grinded and fully removed. So in some cases, it might be the easier option, and also when you're using last kit. But if depending on the oral situation of the patient, there's not much of a room, then you could use dome drill. So biggest difference is the dome drill, it grinds lateral wall and removes it, while in the core drill, lateral window is formed. So I think depending on cases and indications, you can use either of the two. We'll now go to the next question. So residual bone, what is the criteria for using cast and less? So use cascade or last kit? I think that is the question. In the past, 4 millimeters or 5 millimeter was the base of the bone residual height. If it's bigger than that, you do crestal approach. If it's lower than that, if there is a lower residual bone, then you do lateral approach. But I think such a criteria has now become evasive. So personally, I also of course, the remaining bone height is important, but in case number 7 and 5 exists and there's single missing of number 6, then even if the residual is less than 4 millimeter, you have still teeth available right next to them, and sinus width is narrow, then I think it's possible with crestal approach. Just in case, when you do crestal approach, the most important thing will be primary stability, securing the primary stability. And also, if you go for lateral approach, of course, in the past it was based on the bone height. But now, if you are missing the most posterior area, and if you have occlusion force because the opposite teeth is natural teeth, and you have to use the teeth for longer time, then you do bone grafting and think about sinus augmentation. Then, in such case, lateral approach might be the better option. So, depending on the patient case, if it's a younger patient and sinus is wider, or with doing crestal approach, sinus membrane has torn, hence with the crestal approach alone, repairing the torn membrane is really difficult. So with the casket, you do crestal approach, but if the membrane has been torn, then without bone grafting, put in shorter implant. If not, then residual bone height is too small, then with Lasket you can do lateral approach. So the torn membrane can be checked with your eye, and by repairing that membrane, if you approach with this kit like that, I think it will be good. So only basing whether it's crestal approach or lateral approach based on remaining bone height, now it's more like depending on all situations and indications, you opt for the more right one depending on the situation. And with that, I would like to conclude my lecture on Lasket. I hope that through this hands-on, you learned more about Lasket and how to use it. And I would like to end this lecture by thanking for your attention. Thank you very much.
지금까지 시청해 주셔서 감사합니다. 감사합니다.